standard anatomical position. And this is it. The person is standing upright, facing forward, arms at their sides with their palms also facing forward. Now here's the key. It doesn't matter if the patient is lying down, sitting, or whatever. In the language of anatomy, every direction starts from this one single reference point. Always.
So with our starting point locked in, we can now pull out our compass. These are the basic directional terms we use to navigate the main part of the body. You can just think of them as north, south, east, and west.
First up, let's talk about superior. This is our north. It just means towards the head or above something else. So for example, your head is superior to your neck. Simple enough, right?
And you guessed it, the opposite of north is south. So the opposite of superior is inferior. This just means towards the feet or below another part. So following that logic, your stomach is inferior to your heart.
And when you put them together, you can really see the body's main vertical axis. Superior is always pointing up toward the head, and inferior is always pointing down toward the feet. It's like the fundamental north-south line on our body's map.
All right, next up, how do we talk about the front? The term for that is anterior. It just refers to the front side of the body. So for example, your breastbone is anterior to your spine.
And on the flip side, we have posterior, which you guessed it, means the back of the body. Your spine is posterior to your heart. You might also hear this called dorsal, which is easy to remember if you think of the dorsal fin on a dolphin's back.
So here you can really see that front-to-back axis in action. Anterior defines the very front, posterior defines the back, and together they give us a really clear line of direction right through the body's core. Last one for our core compass is this idea of the midline, or median. Just picture a line drawn right down the center of your body, splitting you into two equal halves. Anything close to that line is called medial, and as you move away from it, that's lateral. So your nose is right on the median plane, but your ears are lateral to your nose. Okay, so we've mapped out the core. That's a great start. But now let's get a little more advanced and see how this language works for tricky areas, like our arms and legs, and even the different layers inside the body.
So when we start talking about limbs, arms, and legs, the words change just a little bit. The term proximal means closer to the point where the limb attaches to the body. So your shoulder is proximal to your elbow because it's closer to your torso.
And the opposite of that is distal. That means farther away from that attachment point. Using that same logic, your fingers are distal to your wrist. They're the farthest part out.
So let's lock this in. Proximal means closer to the core, while distal means more, well, distant from it. This pair is absolutely essential for describing any location on your arms or legs with perfect, crystal clarity. Now let's talk about depth. How do we describe layers? Well, the term superficial refers to anything that's near the surface of the body. Your skin, for instance, is superficial to your muscles. It's on top. And if something is farther away from the surface, we describe it as deep. So your bones are deep to your muscles because they're located much further inside your body. This is a perfect way to see how we navigate the body's layers. Superficial is the outermost stuff, like your skin. And as we move inward, through the muscle and tissue, we go deeper, all the way to the bone. It's like a true 3D map. Okay, shifting gears a bit to some really practical positions. Two of the most common ones are prone and supine. Prone is just lying face down on your stomach. Supine is lying face up on your back. And here's a little trick to remember it. You can hold a bowl of soup when you're supine. And this is where it all comes together in the real world, right? A patient might be placed in the prone position for a very specific type of surgery. A doctor checks your pulse on the palmar surface, that's the palm side, of your wrist. A neurologist tests your plantar reflex on the sole of your foot. Every single term has a precise practical job.
All right, so here's a quick cheat sheet of the big ones we covered. For up and down, it's superior and inferior. For front and back, it's anterior and posterior. And for limbs, closer and farther is proximal and distal. That's really the core vocabulary of our body's GPS.
You know, at the end of the day, this isn't just a list of vocabulary words. It's a system designed for precision. This shared language gets rid of any confusion, it helps prevent errors, and it means that no matter where a doctor trained in the world, they're all speaking the exact same language. It's a massive cornerstone of